muscles, 3 muscles that we need to identify. The first one is this muscle that you can just barely see right here that separates the thoracic cavity from the abdominopelvic cavity. What is this muscle right here?
Diaphragm.
Diaphragm, spelled with a G, if we could pronounce it like we should. Diaphragm, right? To remember to spell that G, diaphragm. So that's the diaphragm, that's one of the muscles. Then if we look over here, let's pretend that these are my little muscles here. I've got this little six-pack going here. And notice in the thoracic cage where our ribs are. The word that we use for ribs is costal. And so notice that there are these muscles between the ribs. Those of you that like to eat like barbecue ribs and stuff, you're eating the external and internal intercostal muscles. That's what you're eating. So right here on the outside, with the muscle fascicles, these lines are muscle fascicles. They're not muscle fibers. Those fibers are too small. You have to use a microscope to see them. These are fascicles. Notice that the muscle fascicles are pointing as if you're putting your hand in a pocket, like if you have those overall pants. You guys remember those overall pants, jumper pants? Like putting your hand in a pocket. So that's the external intercostal. Deep to that, going in the opposite direction, would be the internal intercostal muscles. And these external and intercostal muscles are going to be super important when you talk about breathing, especially these external intercostals. Everybody take a deep breath in. Feel your rib cage move out. It's moving out because of these external intercostal muscles, so it's going to be real important. So what I mean by that, imagine that my fingers are muscle fascicles. The external intercostals are pointing down like that, and then Erica, if I may, Erica's fingers are going in this direction. So here's the external intercostal. Can you see where the internal intercostal is internal, and it's the muscle fascicles are going in the opposite direction. So that's the quickest, thank you, easiest way to identify that. On the stomach, we're going to have 4 muscles that we need to identify in one structure. The stomach muscles, remember how I told you they're important because they help to support our viscera in our abdominal pelvic area. This one that has the muscle fascicles erect, going straight up and down, that's called the rectus abdominis. This is the right, this is the left. There's a line in between, a white line, that's called the linea alba. It helps, again, to support those muscles. They attach to that linea alba. So this is the rectus abdominis, the right and the left, and then there are 3 more. The first one is called the external, the oblique muscle. Sorry, just spaced out for a second there. External oblique muscle. And it's this one right here that, again, it's like you're putting your hands, just like the external intercostal, external oblique. The muscle fascicles are pointing like you're putting your hand in a pocket. On this side, they're showing the external oblique. On the right side, they've peeled off a layer. And notice that the muscle fascicles are going in the opposite direction. So these are the internal oblique. If I could, I would have here's my external oblique, I peeled it off, and here's my internal oblique. And then deep to that, going in this plane, what kind of a plane is that?
Transverse.
Transverse plane. See that? The muscle fascicles going in a transverse plane. That's the transversus abdominis. So notice we have 3 layers here. If you look closely at this on the side where they have the external oblique, notice that there are 3 layers right there. See the 3? Everybody see those 3 layers? 1, 2, 3. Everybody see those 3? 3 right there. 3 layers. See the 3, 1, 2, 3. Whereas if you turn to this side, there are only 2 because we've peeled off the external oblique. On this side, you're only going to see 2. So don't get confused with that. You have to look at the direction of the muscle fascicles. If I look at this model over here, we call this the mini-me. If you hear me refer to the mini-me, identify this muscle right here. Rectus abdominis. And what's this over here? The external oblique on both sides. There, they're just showing the superficial. What about if I turn this around and I ask you, what is this muscle that looks like a diamond? That's the trapezius, the left and the right trapezius. What's this one over here? The latissimus dorsi, the left and the right. Remember, you get on the practical exam, you're gonna have to specify right and left. So just get in the habit today, right now, of doing that, and that way you got that down. And then on our chest, 2 muscles on our chest wall, and those 2 muscles are the pectoralis major, your pecs. Those of you that like to work out, the pecs, pectoralis major. And then can you see right here this kind of zigzag right there? That's called when you have a zigzag like that, like if you have a knife that has a zigzag, that's called a serrated edge. So this muscle is called the serratus anterior. Serratus anterior. And what was this one? Pectoralis major. And what was this one? External oblique. And this one? Rectus abdominis. And this one on the outside? External inter between costals. And the one deep to that? Internal of costals. And this one? Internal oblique. And this one over here? Transversus abdominis. Good, good. So you've got that one down. And then, just a few more and we're done. On the shoulders, we have this muscle that looks like a triangle, a deltoid shape. That's called the deltoid muscle. Remember the name for this region of the body? What do we call it? 2 names. I made you give me both.
Acromial.
Acromial and deltoid. So deltoid muscle and the acromial, we're soon going to learn that this is the acromion process. Right there on that, where that shoulder joint is formed. Part of that shoulder joint. And then for the arms, not too bad on the arms. Imagine that I have my arm like this. This muscle on the top, it has 2 heads to it. It's called the biceps brachii. You have to say, you can't just say biceps because we also have a biceps femoris. Biceps brachii. And then on the bottom, opposite to that, is a muscle with 3 heads. That's called the triceps brachii. And then if I take the biceps off, underneath it in the brachial region is the brachialis muscle. So the biceps brachii, the triceps brachii, and deep to the biceps brachii is the brachialis muscle. And then finally on the back of our body, in the gluteal region, remember the gluteal region, is this huge muscle called the gluteus maximus. And then deep to that, right here, right, where you see the end of our, what's called our iliac crest, the top of our iliac crest, it's this part right here of our coxal bone, this little bend right here, so this little bend here. This is the gluteus medius. These are important when you're giving gluteal injections, right? Injection in the butt to your patient. You want to inject in the gluteus medius, not the maximus, even though it's nice and fleshy. I got this nice little booty going on here, because there's a nerve underneath that you can damage. So here's our gluteus maximus. Oh, and I didn't realize this one has even the minimus on this one. Okay? But we just need to know the maximus and the medius. All right, and then I think that's it, guys. That was today.